I did everything I can to do to prove to them that my life is the same, that I'm not sick, that I was a job. And they started discriminating. They started stigma. Like, my cousins didn't want me around their kids. One last thing that really drove me to start taking my meds was a friend of my mom's. I don't have a father, and this guy, he was like a father figure for me. He said on a voicemail that I'm an imbecile, that I'm not a normal 23-year-old, and I shouldn't be mooching on people. That just drew me off the edge. I was just like, hey, you know what? Screw this. I threw everything away. I threw my meds away. I stopped going to my doctors. I stopped talking to my family for 3 years. I even got to, anything that we could get our hands on, like narcotics, drugs, I would do it.
Well, when I met her in 2007, I still didn't know that she was positive. I just happened to discover it one day when I found some prescriptions for HIV medications in her purse. And I asked her about it, and she kept denying it and everything. And it's understandable. I mean, with the stigma attached to it, she wanted a normal life like everyone else. She didn't want, oh, I just met this guy now. Oh, I get these feelings for him, and now he's going to kick me to the street because of this HIV stuff. I didn't even know that she wasn't taking those pills. She just threw them in the trash. And a few years later, she started getting a massive candida flare-up in her mouth, like thrush and everything, the oral thrush. And that transformed into a lung problem that landed her in the hospital, and they diagnosed her with PCP, pneumocystis pneumonia. But that's a classic. I mean, if you're HIV positive and you got a pneumonia or you got the respiratory problem, you go to the hospital, it's PCP. I looked at those x-rays, and I couldn't see any bacterial pneumonia, and I know what pneumocystis looks like on an x-ray because I looked at tons of them online just researching for her at the time, and I didn't see anything there. And a long time ago, to diagnose PCP in the 80s, from what I understand, they performed a lung biopsy, or they opened a person up, took a piece of tissue from their lung and looked at it under a microscope to confirm the PCP organism living in there and doing its thing. But now they could do it in a very simple way with a bronchoscopy. You just, with a bronchoscope, they pull up some fluid from the lung and they can look at it that way. And I asked the doctors there, well, you know it's PCP. Well, did you perform a bronchoscopy to confirm it? The little medical student started crying when I started asking her all these questions. She started crying. They had her on pentamidine, but they also had her on Bactrim, on prednisone, on Avelox, on, what else? Zithromax, heparin. Geez, am I missing something here?
Yeah.
They used to give you morphine.
Dapsone.
No, Dapsone, that one came later.
Yeah.
But my point is, you could look it up. The standard treatment that all doctors agree with nowadays for PCP or prevention of PCP in people who have a lowered immune system is Bactrim. Not pentamidine anymore. First of all, because they discovered that the Bactrim works better. Second, because pentamidine is extremely toxic. There's no way you're going to go off like they wanted to do. They wanted to keep her in the hospital for 21 days on pentamidine, and you're not going to walk out of there on dialysis. It just doesn't exist.
And the pentamidine is what made me sterilized.
Well, that was one of the things that I thought, because she walked out of the hospital sterile.
And they say I went to early menopause.
Because, yeah, that's what the doctor said. She went into early menopause.
Well, I'm 29. At that time, I was 27.
No, this is what happened to us. I bet you it's unique. Because all the things that went down and the confrontations we had with the hospital staff over there and everything was just something out of this mind. They were giving her pentamidine, and I remember as soon as first of all, let me see what happened in the ER when she got there, and she just mentioned pneumonia. They were giving her Avelox, they were giving her a bunch of other antibiotics, and I asked them, because I suspected it was pneumocystis, because at that time I believed the whole HIV/AIDS orthodox side thing, the whole discussion. So I asked him if it's pneumocystis, and the nurse there said, well, we don't know yet. We're just treating her for everything. He's like, yeah, just throw the whole pharmacy at her. Is that science? I don't know. Oh yeah, we're just treating her for everything. We just grab every antibiotic we have. We don't know what the hell is going on. We're just dumping everything we got on her and hoping that one of them works. Yeah, that's a brilliant idea. Okay, whatever. But then after they diagnosed her with PCP, she was hooked up to pentamidine and also a bag of Avalox IV. And Avalox is used for tuberculosis. Why are you giving her drugs that she doesn't need? I mean, when you already diagnosed the pneumocystis, that didn't make sense. Plus, why aren't you giving her the HIV meds? The combination of drugs they were giving her was just immunosuppressive, to say the least. Now, why would you be giving a bunch of immunosuppressants to someone who is already immunosuppressed? They were bringing in a little tank of oxygen so she could go home on the oxygen and everything, until another medical student walks in and says, oh, no, she's not ready to go home yet. Now she's already stressing out. Jessica's already stressing out because, you're telling the patient that she could go home. It's the day before Christmas. She wants to be home with her family. And now all of a sudden you're telling her she has to stay here. But the excuse was, we need to keep her here for another 21 days because the infection is still there. Pneumocystis is not really an infection. Everyone has pneumocystis in their body. It's a fungus, or it's an organism that happens to pop up, when someone is severely immunocompromised. But it's not an infection that you could kill and it just goes away with medicine. I mean, you need to bring up the immune system. If you don't correct that imbalance, you could keep someone on pentamidine for 2 years. You won't even get to that because the person will die. However, I had a problem with that because I knew where they were getting the 21 days from. It's off the little medical journals or whatever. That was the treatment they were given in the 80s to people with pneumocystis, was 21 days, 14 to 21 days on pentamidine IV. Which, by the way, she didn't even have to be on, because usually they use IV Bactrim for people who can't take medication by mouth. If not, Bactrim by oral tablets, because we had to sign AMA. I pulled her out of there against medical advice. 2 times we had to do this. I'll explain the second time in a little bit. But I wasn't about to keep her there in 21 days. I'm like, no, she's going to walk out here with her kidneys destroyed, on dialysis, and we want a second opinion. I'm going to risk that. We both agreed on it. When everyone walked out, there was this one Chinese medical student, and he stayed in there. I don't even remember why he stayed in there when everyone walked out. He was just sitting there next to the wall and looking at his own little papers. And I told the guy, I found this information, the dissident information. And this was the time where I just started discovering this stuff. So I fell into even finding the stuff that's being discounted, like, oh, the virus was invented by the government as a bioweapon, or this and that. I don't know where I was turning, but I definitely knew there was something that didn't make sense. So I told the guy everything I found. But one thing that I told him that he agreed with was they didn't have to give her pentamidine. Those Bactrim pills would have been sufficient. And he just looked down with this face with guilt and stuff, and he goes, yeah, the Bactrim should have been enough. Wow. If you look at all these HIV drugs, the way they work, including Bactrim, Zithromax, and all this, they tend to work by stopping DNA synthesis. Even pentamidine. They say when explaining how pentamidine works, if you look it up online, the mechanism of action, or how the drug works, as far as, I don't know, if it's an antibiotic, how does it kill the bacteria? That's mechanism of action. They say it's unknown with pentamidine. They don't know how it works. And yeah, it works in some way of interrupting DNA synthesis there too. I don't know. Like I said, I'm not a scientist or nothing. I just base myself on what I read. And most of the stuff that I found, the dissident side came later. A lot of it came from the government itself. It came from the National Institute of Health, the CDC, papers that I was digging through their archives and stuff, trying to find information on this drug, or on HIV, or on this opportunistic infection, pneumocystis, or you name it.
When I found out that HIV wasn't real, yeah, through John.
I've heard of people who, for example, they switch to a vegan diet, or they change their diet, or they do something to cleanse their system out, either through detoxing or whatever it may be, and they happen to take another test and it comes out negative. Then you have other people who just happen to test positive all the time because they have those proteins that the test looks for or whatever. I mean, I bet you if you tested me after the heroin addiction that I've been through, all the antibodies I got floating around in my blood, for all you know, I always test positive. You know, it all depends. The test looks for proteins, antibodies, which could be in your body for countless reasons. I mean, they're not virus specific. The P24 protein that the test looks for, that they say is specific to the HIV. The P24 protein, for example, is also found in the brain. It's found in other places. Now, without getting into detail, this is stuff that anyone can look up. It's not like I'm making this stuff up or I was indoctrinated by the Church of Dissidents or something. I mean, this is information that I found by researching HIV. When she went to get her prenatal checkup or whatever, OBGYN, to the gynecologist and so forth, they gave her an HIV test. And she was going to deny to take one. She didn't want to take one, but they told her it was mandatory. And she comes back in the car and she tells me, well, they gave me an HIV test. And I'm like, well, why did you take one? Oh, they told me it was mandatory. And I was telling her it's not mandatory. Who told you that? And she said the doctor told her that. But then the nurse comes in with a consent form. And the nurse tells her, well, yeah, the doctor said it's mandatory, but I don't understand why they make you sign a consent form if it's mandatory. Like I said, by the way, it's not mandatory. They gave her an ELISA test that came out preliminary positive. And that doesn't mean anything because she was pregnant, already 7 months pregnant and so forth. And the doctors admitted themselves at the hospital that HIV test, they cross-react during pregnancy. That's a well-known fact. So leave alone all the other cross-reactions. Pregnancy is one of the major ones. So I confront the guy, and he told me straight up, these are his exact words, we know these tests come out positive all the time in pregnant women, but we don't really have the time right now to wait for a confirmatory Western blot to come back because she's going to give birth in a few hours. So my recommendation is that she's given AZT during labor to prevent, just in case, to prevent the mother-to-child transmissions. And I talked to him about AZT, you know how dangerous this stuff is. I talked to him about, you know, these HIV tests that cross-react to everything. The whole dissident argument about the HIV issue, and he was looking all the time down like this. He couldn't even look at me in the eyes. He's like, I'm not here to discuss that right now. I'm not here to discuss that. I'm just telling you. And I told him, okay, how about this? You sign me legal papers just in case that test comes out positive. You run the confirmatory test, you sign me legal papers saying that you diagnosed her with HIV. And he goes, I'm not going to sign you any legal papers. I'm giggling like that.
Do I live my life in fear? No. I live my life the way I want to live my life. I don't believe in fear. I believe because you have a certain illness or a certain cancer, life is not over. You get to know your illness or your cancer or whatever. Live your life. You know, learn. Go beyond the virus or the cancer or whatever you have.
I pulled her out of the hospital. Like I said, her breathing started improving after 4 hours on that pentamidine. I don't know exactly what it did. I have some theories, but I'm not going to get into it right now. But yeah, they wanted to keep her 21 days. We decided against it, signed against medical advice, and pulled her out of the hospital. And she was on oxygen for a while, but we were going for walks up the street and so forth and so forth. And looky, not even, what was it, a week or two? Yeah. 2 weeks, and she completely got better. I discovered later that what it really was, like I said, she suffers from candida issues. She had a systemic candidiasis. She eats a little bit of sugar or this and that. She's very susceptible. She gets thrush in the mouth and this and that. She unbalances her gut flora. She starts developing thrush, having candida problems. And at that time, what I believe is when she saw oral thrush in her mouth, the First thing, HIV positive, oral thrush, oh, your immune system is destroyed, right? That's a classic. Now, I discovered that really what she was going through was a systemic candida infection, that the thrush started going in her mouth. It started getting worse, We had no idea what it was. She didn't pay attention to it because she stopped that HIV medication she was taking. God, this is something they say in the dissident community, if you want to put it, that those HIV pills, not only they halt DNA synthesis, like the reverse transcriptase inhibitors, they stop DNA synthesis. Then you have protease inhibitors, which block the protease enzyme that the virus uses to replicate. But we have the protease enzyme in our body for a reason. It's responsible for nutrient absorption, building protein, breaking down amino acids for DNA replication. Now I can't remember it all, but it's very important. So if you block it, apart from that, these HIV drugs, they also contain powerful antibiotics, antifungals. Big Pharma doesn't come out and telling you, for example, that Sestiva is a narcotic, one of the components in a triplet. That's why people trip out on that. They have a little acid trip if they take Sestiva, Favirenz. But it is. And now that is a known fact. Okay, so I doubt they're going to tell us what else is in the pills apart from a reverse transcriptase inhibitor or a protease inhibitor or a fusion inhibitor. They do suppress the immune system, and with your immune system suppressed, you're obviously going to get attacked by all kinds of infections and so forth. But if you have these powerful antibiotics, these powerful antifungals in those pills that you're taking every day, what are you doing? You're putting a shield over yourself. You have no immune system, but those pills that you're taking are acting as your immune system. So when you stop taking these pills, your body starts probably rebuilding its immune system. That's what they call immune reconstitution syndrome. What I believe that is you stop the pills, your body kicks in again and starts rebuilding the immune system, starts unsuppressing what was suppressed, and then all of a sudden all hell breaks loose. And I think that's probably what happened to her. There's only another medical condition I could think of that I looked up where they test your T cells, and that's leukemia, or certain cancers of the blood. But as far as a marker, a definitive marker for immune function, who walks around checking their T cells? I mean, when you go to for a checkup at the doctor, the doctor checks your cholesterol, runs all these other little prevention tests. Wouldn't it make sense to run your T cell count, even if you're not HIV positive, just to test your immune system? And, you know, we'll boost it up a little bit just in case it's low. Because, yeah, we noticed you're getting the flu a lot. Or you're getting these little chest infections a lot. Maybe your immune system's kind of low. Let's check your T cell count. No, it never happens. Only HIV positive people, they test their T cells like they're checking the oil in their car. You see, when it comes to people who test HIV positive, there's a range of health problems and non-health problems that these people have. Some people test positive and they're totally healthy. Other people test positive and they have like 10 or 15 different medical conditions because of whatever reason. So there is no advice that I could give that fits everyone. I guess the only real advice that I could give to people that could help and after they tested positive is to ask yourself why you tested in the first place. Find it within yourself to at least say, okay, you know what, yeah, I wanted to take a test because I was doing IV meth or whatever. Or maybe I shouldn't have been going to the club and, you know, picking up all these people to have sex with, and change your lifestyle for the better and try to live healthy. Find the flaws in your life and try to eliminate them. Even if you don't believe in the whole HIV theory, or you do believe in it, and you're taking those pills that the doctor prescribes you, at least take that test as a change marker, something to change your life for the better. I started changing my life for the better after I went through that heroin addiction of mine. One day I woke up and I just like, I can't live this life no more. You know, I can't live every day waking up in withdrawal, going out, and the first thing on my mind as soon as I open my eyes on the bed is finding the fix, and finding my fix for the day, and finding the money to da-da-da-da-da. Yeah, the life of a heroin addict is not fun. And one day I just decided that's it. I'm going to put myself on methadone and get over it. I was getting those HIV pills through the mail, and there was this one doctor there who, this black doctor, he was a real good doctor. He struck my gut feeling as someone who actually cared about his patients. And he looked at my blood results and stuff and like, I don't know, he looked like this weird look on his face. He gave me the impression like something wasn't clear here. Like this guy has a different problem than than a virus circulating in his bloodstream. And I always asked for this guy because they assigned us one other doctor that I really didn't like until this black doctor that I did like came in, and we had the first time that I talked to him. And I kept asking for him after that. You know, I don't want to see the other guy. I want to see this black guy. Then he disappeared. All of a sudden, he was reassigned. Okay, whatever. But with my monthly pills prescription that would arrive through the mail, 1 month I received not only my pills, but a bottle of fish oil and a bottle of N-acetylcysteine. N-acetylcysteine is a precursor to glutathione, the master antioxidant in the body, and it's produced mainly by the liver. And looky, if you're doing things like heroin or overloading yourself on acetaminophen, like taking Vicodins or this and that, you're gonna deplete your glutathione reserves in your liver and inflame it and so forth. And I started asking myself, who sent me these and why? Because those are supplements, first of all. They're not covered by insurance. At the beginning, when I saw those, she got her package too. And I was asking her, oh, did you get these too? These fish oils and these things? She didn't get it in her package. Because I was thinking, oh, well, it's close to Christmas time. Maybe for all you know, they're having a little promotion. Try these out, and if you like them, you'll buy them. I don't know. That's what I was thinking. But no, I just got them once. She didn't get them, and never again. Well, that black doctor, I think, sent them to me. I have this strong feeling that he knew I could connect the dots somehow. And I was going through a methadone treatment. There was one thing that we do every 2 weeks. I don't know, it was policy over there, I guess, to do so. They were testing you for hepatitis, HIV, and so forth. They had to have those tests on paper just to show that the people going through the program were adhering to whatever their policy was. I did test positive for hepatitis C, but I never tested positive for HIV. And my liver was this size. I had like elevated liver enzymes, like 300 or something like that. Not too high. I mean, there's higher than that, but after I quit doing heroin, they stayed at 300 and they never went down, they never went up. Until I started taking those N-acetylcysteine pills and those fish oils. Now my liver's normal. Fish oils, for example, everyone's deficient in omega-3s, and they don't get enough omega-3s in their diet if they can include a fish oil, krill oil, hemp oil, flax oil, wherever you could get your fatty acids from. Everyone should do that, in my opinion. You know, and if you're taking stuff like Vicodins or those pain pills that they give you, yeah, a glutathione supplement could be really beneficial to you, and even supplementing your glutathione from time to time is good too, because we live in an environment where there's pollution everywhere, we're exposed to toxins, your glutathione levels could be low. There's a way that you could go to a naturopath or whatever and have them checked and supplement them as necessary. But I believe there's certain supplements that everyone should be taking, and we do so, but you know, they get kind of expensive. So probiotics are necessary because the majority of the immune system is located in the gut. We have a gut flora that's comprised of beneficial bacteria and some bacteria that are not so friendly, and fungi. What happens if you, I don't know, for example, you take too much amoxicillin or penicillin or any other type of antibiotic that just kills everything in your gut flora, good or bad, the bacteria causing you the problem that you're having with your health?
I found out I was pregnant. It was like a miracle, because I thought I was sterilized, like really. And then I found out he was coming, and I was just happy.
Well,
I actually enjoyed being pregnant with him.
Yeah, she was sterile for 3 years. This guy told us, well, since her immune system is practically destroyed, and this was a time that she just got out of the hospital with the PCP stuff, so her CD4 count was very low. It was 2, apparently.
And I always believed that you can rebuild your immune system. Yeah, it can be destroyed, but the human body can be.
The immune system starts regenerating itself even after a person is given full body irradiation.
You know, an amazing thing. It can do amazing things, which means you can rebuild your immune system.
And that's what you plan on doing with baby Dominic?
Yeah.
Well, I'm hoping he doesn't need it. I mean, babies usually recover quicker than adults, you know, so we'll see how it goes. I know how to pick up on stuff, but, you know, it's... Yeah, that's what they told her. They told her that she went into early menopause because her immune system was dead.
Yeah.
And I asked the doctor, run some hormone tests on her. You know, like to do it in gynecology clinics just to test if you're fertile or not. He didn't. He was acting like he was ignoring us. This time in the hospital, they did run the hormone test without us even asking, and the doctor told him, "You're not sterile."